Hello and welcome to this Friday weekly webinar. Today to talk about holistic approach of cancer management in Unani medicine and appraisal, we have with us Dr. N. Zaheer Ahmed sir, who is Deputy Director, Regional Research Institute of Unani Medicine, Chennai. I heartily welcome you sir. आपका बहुत बहुत स्वागत है.
Thank you.
We also have with us Director of Morarji Desai National Institute of Yoga, Dr. Ishwar V. Basavaraddi sir with us. आपका भी बहुत बहुत स्वागत है sir. We also have Communication and Documentation Officer of MDNIY, Mohammad Tayyab Alam sir with us. आपका भी बहुत बहुत स्वागत है sir. Now, without any further ado, let us start the program with prayer. Om Sahanavatu Sahano Bhunaktu Sahaviryam Vavahi Tejasvinavaditamastu Ma Vidvishavahi. Om Shanti Shanti Shanti. Morarji Desai National Institute of Yoga conducts webinar on each Friday by inviting scholars from various fields. Today, to talk about holistic approach of cancer management in Unani medicine and appraisal, we have with us Dr. M. Zaheer Ahmed sir. मैं आपका पुनः एक बार स्वागत करती हूँ sir. I welcome you once again sir. And I welcome Director of Morarji Desai National Institute of Yoga, Dr. Ishwar V. Basavaraddi sir once again. आपका भी एक बार पुनः स्वागत है sir. And I welcome Mohammad Tayyab Alam sir, who is CATO of MDNIY once again. आपका भी एक बार बहुत बहुत स्वागत है sir. And now I would like to request Mohammad Tayyab Alam sir for further proceedings. Sir.
Thank you, Dr. Vandana. Good evening, everyone. Today we have with us respected Dr. N. Zaheer Ahmed sir, Deputy Director, Regional Research Institute of Unani Medicine, Chennai, who will talk upon holistic approach of cancer management in Unani medicine and appraisal. Dr. Ahmed sir is actively engaged in clinical research and rendered his service to Central Council for Research in Unani Medicine, New Delhi, Ministry of Ayush, Government of India, for nearly 3 decades. He has carried out various IMR, EMR projects in-house and collaborative clinical and pre-clinical studies as principal investigator and co-investigator. He is also a co-investigator in the NMPV projects of Regional Raw Drug Repository. He is a gold medal awardee for securing highest rank in BUMS final year and also honored with gold medal for securing highest marks in Mulazat. Dr. Ahmed was conferred with various other awards, most importantly Best Researcher Award by Hamdard Laboratories, New Delhi in 2007, Best Paper Presentation Award from Unani Stream in First International Ayush Conference and Exhibition in 2017 at Dubai, and Best Research Paper Publication awarded by Central Council for Research in Unani Medicine, New Delhi, Ministry of Ayush, Government of India. He has attended and presented papers in around 30 national and international conferences, seminars within the country and abroad. He has over 70 publications to his credit. Thank you, sir, for accepting our invitation for Friday webinar, which has been organizing since 2nd October 2020 on every Friday. With these few words, I would like to invite respected Dr. Ishwar V. Basavaraddi sir, Director Murarji Desai Institute of Yoga, to say few words about today's topic. Sir.
Om Shanti Shanti Shanti. Most esteemed speaker of this today's Friday webinar, Dr. Zaheer Ahmed ji, who is the Deputy Director of Regional Research Institute of Unani Medicine of Chennai. It's our sister organizations of the Ministry of Ayush. And my colleagues in the institute, Shri Tayabalam ji, Dr. Vandana, faculty members, student friends, and yoga enthusiasts joining this webinar through various social media platforms of the institute from different parts of the world. My pranams to you all. So I once again on my behalf, hearty welcome to you all, including the esteemed speaker of today's talk. First of all, being a yoga institute, we not only concentrate on yoga, but also the allied sciences and our sister systems for two reasons. One is to give the proper insight about various healthcare delivery system, particularly Ayush systems. The second one is like diet, nutrition, holistic health, public health, and many other disorders like diabetes, hypertension, cancer, now the recent pandemic, COVID. So as the health emergencies, so we always choose the topic and eminent speakers so that the target population here, mostly the yoga students, faculty, and yoga enthusiasts who really want to explore and develop knowledge and skill. But at the same time, they are very happy. Even we have taken up the public interest topics. So this time, why I'm giving this background, this time we've chosen the topic on holistic approach of cancer management in Unani medicine. So there are 2 days. One is homeopathy day. So it's also falling, and another one is the cancer day was also celebrated. Matlab observed, not celebrated. So to draw the attention of the public on these two systems, the strength of Unani medicine in many of the health conditions, disease conditions, and cancer is spreading like anything after heart attack. Cancer is taking the next place. It's one of the deadly disease, and it's a very costly also. It's called disease of the rich. So therefore, awareness is the most important thing. There are many systems modern medicine people go, but Ayush has a lot of strength in T aspect. One is in the prevention. It may be Unani or Ayurveda or whatever it may be. Second one is treatment itself. In certain disease conditions, our system have the treatment for the cancer. Then third one is rehabilitation. So as far as yoga is concerned, it's preventive. Second one is it will act as adjunctive therapy along with any medicine. It may be modern medicine or Unani medicine or Ayurveda medicine. So it will work as an adjunctive therapy. Or then third one is yoga plays a vital role in rehabilitation of the cancer patients. So in this aspect, today the holistic approach. So there, whenever Ayush system, holistic means even Unani or Siddha or any system. Devarukta. So somewhere when it comes to the mind and higher aspects, definitely the yoga comes into play. But today, our esteemed speaker will draw the attention about the concepts of Unani medicines, like it starts some Totam, and which are very similar. The language is different. It's Persian language. He will explain all these things. And but in Ayurveda and yoga, so they are from the uh, yeah, Sanskrit or Devanagari literature they used. These are the only thing. That's why the words or the language is different, but the meaning or these things are almost similar. What I read as a part of my these things. Therefore, today we'll get to know about. My request is to enlighten our students and faculty regarding the uh, Unani medicine and its strengths. The second one is the how cancer can be prevented. That's the one thing, and how holistic management through Unani medicine cancer can be treated and also rehabilitation. So these are the three important lines Dr. Zaheer Ahmed is going to draw. So once again, I'm so happy, and I do know that you are very busy person as a head of the your center and a lot of responsibilities. And Friday, it's many people say it's weekend starts, but so we enlighten them and then we'll continue with these few words. So I welcome you, Dr. Zahir Ahmadji, and I thank my colleagues for choosing a very right person for the week where we are celebrating Unani Day is going to come, and also the Cancer Day was being celebrated. Thank you. I now invite our esteemed speaker to address us, Dr. Zahir Ahmad.
Bismillah ar-Rahman ar-Rahim. Thank you, Professor Basavaraddi ji. Esteemed Director of Morarji Desai National Institute of Yoga, faculty members, students, coordinator Dr. Mandana, Dr. Alam. I begin with the universal greetings. Assalamu alaikum wa rahmatullahi wa barakatuh. May Almighty's peace, mercy, and blessings be upon all of us. With this prayer, I begin my lecture. In fact, I'm at the outset, let me congratulate the director for his farsightedness. In the sense, through these type of webinars, the students are going to be enriched with a diverse field of knowledge. Unless and until you have a very far-sighted vision, and with the help of this, the students may learn a lot, and that will be very helpful for them in the future. For that, I congratulate once again the esteemed director of National Institute of Yoga and faculty members and students who are joining in this webinar. In fact, I have been asked to enlighten on the concept of healthcare in Unani medicine. Of course, that's a very important topic, and I hope I'll be given another opportunity in the near future to articulate on this particular subject. But since today falls the February 4th, which is universally observed as a World Cancer Day, so I thought it better that we should create an awareness about cancer. That is what WHO at the global level, ICMR here in India, and various research councils and national institutes of Ayush systems are supposed to be aware about the developments which are taking place, particularly about the cancer. Let me share my slides. Slides are visible?
Yes, sir.
Yeah, thank you.
Yes, yes, yes.
Yeah. So, this for the coming 3 years, that is from this year onwards, from 2022 to 2024, the WHO has devised the theme as close the care gap. Close the care gap. The care which is being extended to the persons who are affected with cancer, the gap has to be narrowed. That is what their objective is. WHO recognized the power of knowledge. We know that every single one of us, each one of us, young or old, rich or poor, white or black, male or female, or transgender, right and left, east and west, there may be leaders or followers, there may be believers or non-believers. Each one has the ability to make a difference, large or small, and that together we can make real progress in reducing the global impact of cancer. Everyone far more unite us than it divides us. This 4th February, World Health Organization calls each one of us, whoever, wherever they are, to play an active part in creating a cancer-free world, and we need to close the gap in cancer care. With this outline, I'll be trying to explain the concept of cancer in Unani medicine, the pathogenesis, how it has been described in the classical texts. No disease has been so extensively uh, dealt in the Unani classical literature than that of cancer. Unani physicians have not only described the concept of cancer, but also cited its management through different regimen, both preventive and curative. So my topic would be, I will briefly deal on these heads: introduction, definition, incidence and prevalence, etiology and pathology of the cancer in Unani system, the risk factors involved, how cancer is classified, what should be the aim of management, and how we manage in the Unani system, and finally conclusion. You must agree that Unani medicine is 2500 years old, and it has served a glorious service to the humanity. And the 11th February is the Unani Day in remembrance of the birth anniversary of Hakim Ajmal Khan. See, the propounder of Unani system is none other than the Hippocrates, the father of medicine, who has given the concept of Unani system of medicine. Next comes the Ibn Sina, who is a Persian physician. Then Hakim Ajmal Khan is not only an eminent Unani physician, but also a researcher, an educationist, and a freedom fighter, and a contemporary of our father of our nation, Mahatma Gandhi. So his contributions are manifold, and to remember him on his birth anniversary, every year 11th February is celebrated as Unani Day. Since many students are there in this webinar, one must have a brief understanding about what exactly Unani system of medicine is. Unani means in Arabic is called it's called, in Greece we call in Unani. In Arabic we call Unani, which means Greece. Since the origin is Greece, that's why the name is still preserved and maintained. And its history can be traced back to the 4th and 5th century BC, when it was propounded by Hippocrates, the father of medicine. Then this scientific system has been developed by Romans. The popular figure among them is Galen. These people enriched the system and stabilized its foundation. Then it was developed into an elaborate and medical system by the Arabs, who were particularly during the from the 8th to 15th century, The Arabs and the Persians were the masters of this art. The system is known in different parts of the world with different names, such as Greco-Arabic medicine, Ionian medicine, Islamic medicine, Persian medicine, traditional or Oriental medicine, etc. In in India, the Unani medicine was introduced by the Mughals, that is, they were Persians, in 10th century AD, and brought with them the physicians practicing this healing art. They made further advancements and developed the Unani system of medicine into a complete science and successfully applied its principle to the local geo-human environment to become one of the major traditional systems of medicine in India. Due to its rich heritage, sound, robust concepts, suitability, efficacy, and non-toxic nature of the drugs used, Unani medicine achieved acceptance and popularity among the masses. Indian scholars and physicians not only practiced it but also contributed a lot and redefined it on the basis of their experiences. That's the reason we see that when these physicians who popularized the system in the India, whatever uh, flora and fauna which is found in this Indian subcontinent has also been incorporated with their experiences and observations and experiments. That is how we see that in Indian system of medicine, the medicines which are used found its origin in Europe, in Middle East, Persia, and Indian subcontinent. So a diverse group of drugs are used in United system of medicine. As far as the history of cancer is concerned, it is one of the most oldest disease. The earliest evidence of cancer is found among fossilized bone tumors. Human mummies in ancient Egypt, and we also see from ancient manuscripts of Unani and Ayurveda literature the mention of the reference of this particular deadly disease. It's not a modern day disease, but it's one of the oldest disease. Growths suggestive of the bone cancer which is called now osteosarcoma, have been observed in Egyptian mummies. And Hippocrates was the first person to use the term carcinos in Greek, which is literally means crab, to describe non-ulcer forming and ulcer forming tumors. The Roman physician Celsus later translated the Greek term into cancer, the Latin word for crab. Galen used the word onkos, which we call in Greek for swelling, to describe tumors. So this is how the nomenclature of the cancer differed from place to place, in the language to language, and the present term is still being maintained by the present day literature as well as the science. What exactly is cancer? To be precise, cancer is defined as malignant neoplasia marked by the uncontrolled growth of cells, often with invasion of healthy tissues locally or when it spreads throughout the body in the form of metastasis. In Unani terminology, how it has been described is as a verme salabat, a hard inflammation with lesion and their tributaries filled by Madde Sodavia. Madde Sodavia means one of the humor, when it undergoes morbidity, it turns into a morbid black bile. So this is how this disease has been described in Unani literature by Ibn al-Khaf Masihi in his one of the treatise Kitabul Umda fil Jarahat. Let us know the global impact of cancer. According to International Agency for Research on Cancer, every year 19 million new cancer cases are diagnosed. 19 million new cases are diagnosed. The mortality of cancer is nearly 10 million cancer cases. That is worldwide, 10 million patients die due to cancer. And it is the second largest cause for death after cardiovascular diseases. And at any given time, you see that the morbidity of this particular cancer is about 50 million people are living with cancer. This is as per the estimates of Global Cancer Observatory. As far as the National Cancer Registry Program estimates that in 2020, that is, cancer cases in the country will be 13.9 lakhs, which will likely to increase to nearly 16 lakhs by 2025 based on current trends. So still, in spite of all the awareness which is being created among the masses through different type of programs, through different lifestyle changes, still the growth is uncontrolled and it is increasing at an alarming speed. We must understand that health and humor has a great role in Unani system of medicine. There are 7 basic physiological components on which human body exists. Among these 7, humor is one of them. Health is dependent on normal concentration and temperament of 4 humors, which is called dam, blood, balgam, phlegm, safra, yellow bile, and sauda, black bile. That is, a Unani system of medicine is based on the 4 humoral theory, whereas the Ayurveda system relies on 3 dosha theory. The difference is the black bile, which is called sauda in Unani. These humors are produced in the liver. All organs get their nourishment from different humors, chiefly blood, which further depends on normal quality and quantity of it. These 2 important characteristics of blood entirely dependent on effective digestive system of body, along with a balanced diet in terms of quality, quantity, timings. All this depends on the, so a major role is plays the metabolism. Unless and until the metabolism is set right, the good humors cannot be produced. So the digestive system has to be healthy, metabolism has to be healthy for the production of normal humors. So with this background, as we have understood that formation of all the 4 humors occur in liver, the precipitated substance of blood, all these humors are intermixed in the blood. The precipitated substance of blood is called the normal black bile. The normal black bile is the least inferior in quality among all the 4 humors due to its contrary temperament of blood. Blood is considered, the temperament of blood is considered to be hot and moist, which is of the supreme quality. Whereas if you see the temperament of the black bile, it is totally in contrast with that. That is cold and dry. Blood is hot and moist, whereas the sauda, black bile, is cold and dry. So contrary temperament, that's the reason it is considered as inferior among all the 4 humors. But it has its normal, black bile has its own function to play in the human body. This normal black bile is divided into 2. One is called sauda rasubi, which is derived from the sediment part of blood, and the other one is sauda heterakhi, which is formed as an end product of 4 humors after their combustion, which is usually results in morbid black bile. How this black bile, abnormal black bile, is produced is based due to alteration in its temperament, or due to excessive consumption of black bile producing food, or it may be due to excessive heat in the body, which results in combustion of these humors. As I said earlier, black bile is considered to be an inferior quality, and so the ethraki is an extremely harmful and more prone to malignancy with corrosive properties. This putrefies the tissue and develops it into an obstinate ulcer. So we have seen that there are two types of Sauda, black bile. One is Rasubi, and the other one is Ehtrachi. And this Ehtrachi, the Sauda which is produced due to the combustion, has that malignant property in it, out of which different type of cancers are produced in the body. So this morbid Sauda is the main cause, which is found by Ehtrachi Sauda. Diseases caused by this black bile can be explained on the basis of alteration in their quality and quantity. Hence, maintenance of the right proportion in akhlat in terms of quality and quantity, which we call homeostasis, is vital in maintaining health, and any derangement in terms of quality or quantity results in disease. Let us see the causative factors for the development of cancer. There are two causes. A, intrinsic, which is called non-modifiable, which you cannot modify. It is beyond our control. And the second one is extrinsic factors, which are modifiable. Under intrinsic factors, age is one of the most important cause for development of cancer. As the age develops, as a person lives for a longer period, as he's exposed to so many different hazards, that makes him vulnerable to cancer. Likewise, a person who has a dominance of black bile temperament, particularly the cold and moist cold and dry temperament, are those persons whose temperament is very dry, and those people who have the history of cancer in their families. These cannot be altered at any cost. That's the reason they are brought under non-modifiable factors. And the second one is the extrinsic factors. Extrinsic factors are also modifiable. This is in our hands. And everyone agrees that cancer is something which is related to the lifestyle. Unless and until a person changes or modifies his lifestyle, he cannot be free from disease. We see that a lot of people are getting cancers because of their faulty lifestyle, which includes predominantly taking this cold and dry diet. That is such type of diets which helps in the more production of black bile. Then we have certain occupational hazards that also results in production of cancer. Erratic food habits. Erratic food habits is one of the main risk factor for the production of cancer. We will see in the coming slides that how far this erratic food habits uh, assist in development of cancer. Then you have tobacco, alcohol. These are all the risk factors which is there in our hands. If we understand the evil consequences of these habits, addiction, one can be to a large extent free from cancer. And then you have the role of general hygiene, oral hygiene, and sexual hygiene. All this, if is followed in its right perspective, so many cancers could be avoided. Physical inactivity is also one of the main reasons for the development of cancer. Obesity has been proved to be one of the important risk factors for cancer. Over radiation, excessive taking of X-rays, all these results in the development of cancer. So WHO says that more than 50% of the cancers could be prevented. Out of this, the lifestyle changes, the risk factors which I have described now, comes and a total percentage of 7 to 75%. Infections 15 to 18%. Genetic factors comes 5 to 10%. So if the non-modifiable factors are there, that may result in cancer, depending upon the immune system of the person. Suppose if a person has the second B factor, that is extrinsic factors, he may or may not get cancer. But if a person has the both A and B, that is the intrinsic as well as extrinsic factors in him, then there are more high chances of cancer. What we are trying to create awareness among the public is, you try to refrain from this faulty lifestyle, which will to a great extent will result in the reduction of cancer rate. So we must understand that the extrinsic factors which are modifiable has to be, more awareness has to be created on these aspects. As far as the common cancers in India is concerned, it depends, it varies from gender to gender. In male, we see that oral cavity, lung, esophagus, stomach. So oral cavity, we see that in the rural India, most of the people chew the tobacco in some form or other, like Manikchand or the Mawa and something like gutka and all. These people keep there in their under their tongue, and that results in the oral cavity cancer. So this could have been prevented if people would have been aware about the dangerous consequences of this continuous use of tobacco. Likewise, lung is involved in male patients because most of these patients who become cancer, when we take their history and the cohort studies prove that smoking is one of the known risk factor for the development of lung cancer. Then the esophagus and stomach, as we all know, that due to the excessive consumption of alcohol, these organs get affected. First, it is gastritis, then it is ulceration, then that ulceration leads to further growth of the tumor, then larynx. So if you see in the males, almost most of the cancers could have been prevented if they would have modified, the person would have modified his lifestyle. Likewise, in the females, if you see the largest cancer which is found in India is the breast cancer. A mass awareness has to be created among the female students. It is a very simple breast examination by one which once if a lump is found in the breast, sooner they get examined it through simple test, one could bring a lot of changes in preventing to in going into severe form of disease. Likewise, cervix. Cervix, we all know that HPV, human papilloma virus, is responsible for this, for which vaccines have come out. To a large extent, cervical cancer is coming down. But the usage of this HPV vaccine is, we see that it is very, very negligible. Then ovary, then comes endometrium, then oral cavity. This is how the common cancers are found in India. And what the Unani physicians have described about is most commonly cancer is occurred in asaya rataba, that is moist organs. They have mentioned that those moist organs are breast, uterus, palate, stomach, intestine, etc. All these are moist organs which are most commonly affected. They have told it 1,000 years before itself. How the classification of cancer occurs? We know that the carcinoma, usually the cancer is classified according to the tissue involved. Suppose if the tissue involved is epithelial tissue, which covers the outer lining of the organs, it is classified as carcinoma. Likewise, when a connective tissue is involved, then when connective tissue is involved, particularly bone, cartilage, blood vessels, then it is termed as sarcoma. Likewise, you have myeloma, which is the uh, You have uh, myeloma, which is something related to the immune system. Then you have leukemia, that is cancer of WBC. You have lymphoma, that is also where the immune system is involved. Then there are certain cancers where there is involvement of two or more tissues, which leads to the cancer. Then the cancer is also classified according to the site involved. As we've seen that most commonly affected site is the breast cancer, then comes the lung cancer, then prostate cancer, then liver, then renal cell carcinoma, and so on and so forth. This is how, depending upon the site, the classification of cancer is made. How the in Unani system of medicine the cancer is managed. First thing is, as we all know, that there is a concept of health preservation in Unani system of medicine uh, that is mainly concerned with lifestyle modification. This is the preventive aspect of the management. Then the arrest of the spread of cancer, the spread of the cancer has to be arrested by certain measures. Then the complete resolution of growth, including its root, has to be taken care of. Then measures have to be taken to prevent it from ulceration. If it is ulcerated, then it has to be treated accordingly, depending upon the different mode of treatment in Unani system. In Unani system, usually it is the management is either preventive or curative. As far as preventive medicine is concerned, it is dependent on 6 essential factors, which is called asbab sitte zaruriya. That is 6 essential factors for the prevention of disease. It lays great emphasis on to strike balance between them. These factors influence the human body in respect of preservation of health or causation of disease. If I be given the opportunity to highlight the concept of healthcare in Unani medicine, I will be talking a little detail about each one of these. To be precise about in this lecture, we all know the importance of a clean air in the preservation of health. Hippocrates, 2500 years ago itself, has stated that a person has to live in a clean, airy, open, ventilated houses to be free from disease. The concept of clean air has been well mentioned in Unani classical texts. Now we talk of climate change. There is a hole in ozone layer and all, but Unani system recognizes the role of a clean atmospheric air in the preservation of health. For this, it has also advised to plant trees nearby so that the oxygen we get from those plantations and trees will help us in maintaining a good health. Then you have food and drinks. Each person has its own temperament, and a person has his own liking for some foods and some drinks. These foods and drinks has a great role in the production of the humors in the body. If the food and drink is erratic or impure, then naturally it will be producing the impure humors, which will lead further to disease. Hence, it has been emphasized again and again in Unani system of medicine that food and drink has to be according to the person's temperament. It has to be in a give, that is the person who is taking these food and drinks should be in a good quality. The quantity should be balanced. The diet should be balanced. It should contain both the proteins, the carbohydrates, and fats in its given proportion. So that is how it speaks about food and drinks. Then the third one is the physical movements and repose. We know that the physical inactivity plays a great role in the production of diseases, particularly cancer. As already I have described about this, the physical inactivity. We see that some people do rigorous physical movements, some people take so much of physical rest. That is also a dangerous thing. So a balance has to be there between the physical movements and the rest. for which so many exercises have been advised in the Unani system. Then the fourth one is the harkat sukun nafsaniya, mental movements and repose. You know that the human body is composed of body, mind, and soul. Three things together forms a human being. So when we treat patients, we have to take care of not only the physical aspect of the body, but also the mental aspect as well as his mind. For this, great emphasis has been laid on the measures which could, and we also see that there should be a balance between these two. So many psychiatric and psychological disorders occur as a result of imbalance between these two. Particularly during COVID times, we know that every person is undergoing a severe mental stress. So this all produce indirectly so many lifestyle diseases which one could avoid if we strike a balance between the mental movements and repose. Here comes the role of meditation, the yoga, the mental exercises which we teach to the public. So, so the United system also recognizes the role of this, not only the yoga, but also so many mental movements that is a person has to give work to his mind, to his soul. Neither he should give too much work, nor he should give too less work. So there should be a balance between these two. That is how that is where the role of yoga also comes in the Unani system. Then the concept of meditation is there in every system. So meditation takes care of particularly the mind, which is very important in the maintenance of health. Next comes the role of sleep and wakefulness. Everyone will accept that unless and until there is an optimum sleep, depending upon a person's age, lesser the age, more the sleep, higher the age, lesser the sleep. So there should be a balance between sleep and wakefulness. Now we see that most of the people are so engrossed in the use of gadgets, so they at least maintain the balance between the sleep and the wakefulness. Here again gives a lot of room for the production of so many psychological and psychiatric diseases due to the imbalance between the sleep and wakefulness. And the sixth one, ihtabaz wa istifragh, retention and excretion. There are fluids in the body which has to be excreted in a given quantity. If that is increased, for example, if a person passes lot of urine, that may lead him to so many diseases. So it has to be in a balance. Neither it should be too high nor it should be too low. You take the case of stools, you take the case of perspiration, menstrual cycle, any fluids which has to stay in the body. But if it increases beyond its normal proportion, then there are certain measures which are adopted to retain it or to excrete it when it is retained. So there has to be a balance between this retention and excretion. The whole metabolism also lies on the proper functioning of these two factors. So all these six factors play a very important role in the whole concept of preventive medicine in Unani system is based on these six essential factors which I have told you. And the second management is based on the that is knowledge which we say medicine, curative medicine. Principles of treatment in Unani system is based on four different types of treatment. One is ilaj bil ghiza, that is called dietotherapy. Then we have ilaj bil dawa, which is from treatment through drugs. We have ilaj bil tadbir, which is called regimenal therapy, which is in Ayurveda you have panchakarma, and in Unani system there is a concept of ilaj bil tadbir, wherein nearly more than 40-50 different procedures are there to set right the human body when it is diseased. That can be used prophylactically as well as therapeutically. And there is a concept of ilaj bil yad, that is called surgery. This concept is also there in Unani system. Unani physicians were pioneers in their time in the field of surgery. Now, coming to the curative aspect of this, I have again enumerated into, classified into four things which I have described now. And the first thing is illogical ghiza. I have already told you, a person who is of the temperament of sard khushk, that is cold and dry, that is the temperament of sauda, that is black bile, is cold and dry. If he also takes a lot of such black bile producing foods, then he will be more likely to get the different types of cancers. Hence, it is strictly advised for such people to avoid those foods which produce a lot of black bile in their diet. So this is the first and most basic step, which is called radiul kaimus axia, the diet which is not easily digestible, which stays in the intestine for a longer period, giving room to develop so many toxins, and that may lead to a faulty metabolism, resulting in faulty production of these humors. It is advised to give only jayyidul kaimus, diet which is easily digestible and which is light in nature. This has been described in the Al-Qanun fi Tibb by Ibn Sina in his book. Likewise, growth can be managed initially by treating with tankhiyah mawad. Suppose if a person has cancer, then it has to be treated by uh, first the affected. We know that the humor which is involved in the production of cancer is the black bile. So these black bile will be through with the administration of certain drugs, which enables it to uh, which enables it in a way that could be easily expelled from the body. So such type of diets like kaddu, which possess anti-cancerous activity, hurfa, amaranthus polygamous, batua, khira, khissa, cow's churned milk, mouse shair, that is water of barley. All these possess anti-cancerous activity, and these could be used for the expelling of the black bile matter from the body. There are certain food items which are contraindicated in the classical text. Since these food has the temperament of cold and dry, that is the reason this particular diet has been strictly abstained, so that the more amount of black bile is not produced in the body. So these are all the food items which are contraindicated for any person. Then you have the role of drugs. Cancer, it has also been clearly told that cancer can only be treated in its initial stage, but the diagnosis is very difficult. This statement is there in the Unani classical text. We know that initial stage cancer is not easily diagnosed unless and until it is incidentally diagnosed. It is very difficult. Only at a later stage, when it produces pressure effects, and unless and until the symptoms are very evident, a person may not be aware that he is suffering from cancer. So if it is treated, it would be treated only in its initial stage, that they have clearly told. At the same time, the diagnosis is also very difficult, because those cancers which are in the epithelial tissue, in the internal soft covering of the internal organs, it is very difficult to diagnose unless and until it is some symptoms are evident. And it is also advised that the line of management for such type of this cancer is munzij and mushila sauda adviya, drugs which possess the concoctive and evacuant property of black bile. So this is how the management of cancer is carried out in any system of medicine, by the administration of munzij and mushila sauda adviya. It's called concoctive and evacuants of black bile. There are mention of certain anti-cancer effect plants in Unani system. For example, I have highlighted here few. Razi in 865 to 925 AD. He has recommended 131 plants, and Ibn Sina during the 10th century AD has described 55 plants which has anti-cancer effect. There are 36 common plants distributed over 27 families which have been used both by Razi as well as Ibn Sina. The compound drugs sometimes include more than 20 plants or plant parts at a time that are blended to form decoction, ointment, or a paste. That has also been described in the Unani literature. A successful anti-cancer drug should kill or incapacitate cancer cells without causing excessive damage to normal cells. This ideal is difficult or perhaps impossible to attain, and is why cancer patients frequently suffer unpleasant side effects when undergoing treatment. So you have to target the cancer cells exclusively, means that is in, but at the same time, unless and until the drug has a cytotoxic property, it will not act upon the cancer cells. So but since the herbal drugs has a combination of both the active and the passive alkaloids in any given raw drug, so those unpleasant side effects are taken care of by the herbal drugs when compared to the conventional drugs. Here I have highlighted a list of plants which are used as concoctive and one which evacuates the black bile from the body. You have a common plant that is Aslesos, Glyceria glabra, very famous root, which is used even in Ayurveda also. Then Gauzuban, Borago officinalis, its leaves are used. Then the same plants, flowers are also used. Badian, that is Funiculum vulgare, soft जिसको कहते हैं हम, that is also used as a concoction of black bile humor. Then the roots of Badian, soft, Biche Kasni roots, Cicorium intibus. Then the seeds of Kasni, all these medicinal plants has the property of Munzija Sauda as well as Mushila Sauda. Then you have the Rosa damask, which is called Gule Surukh, जिसको हम गुलाब बोलते हैं. This is also used for this particular Munzija Mushila Sauda. You have a Lavandula stochus, this is called Osteosarcoma in Unani. This whole plant and flower is also used in the treatment of cancer. And you have a Fumaria officinalis, which is called Shahatra. The whole plant is used. Then Althea officinalis, Tukhme khitme, the seeds are used. Alu Bukhara, जिसको हम Prunus domestica कहते हैं. The fruit pulp is also used in the evacuation of black bile from the human body. Then you have grapes, Vitis vinifera, that is also used as a drug which expels, which concocts and expels the black bile from the body. Halilaceae, terminalia cebula, the fruits are used. Aftimun cuscuta reflexa, its stem is used. Bisphaige, Polypodium vulgare, the stem is used. Milenafti, the black salt, the salt part is used. Kutki, Mycorrhiza curua, the roots are used. Varichun, Polyporus officinalis, the roots are used. Kalonji, Nigella sativa, the seeds are used. So all these 20 plants has been described in the Unani literature. जैसे हम कहते हैं कि मुंजिजे सौदा और मुसीले सौदा. These drugs are used in different proportions and different combinations, in different dosages and different dosage forms. If when we try to see the studies which has been carried out on these plants, we found that there are so many. These plants have got this anti-cancer activity on the cell lines, in the animals, as well as in the human beings. So all these references I have given of these plants. Now, particularly the plants with anti-cancer activity, the studies which have been carried out on these medicinal plants, particularly Aslosus is a very widely used drug. It has got its own anti-cancer activity. It has been studied in vitro, particularly in several breast cancer cell lines and also gastrointestinal cancer cell lines, different colon cancer cell lines. So all these studies have proved that this drug has got its own anti-cancer activity. Likewise, I highlighted Gauzuman, Virago officinalis. This has been proved to have an in vitro anti-cancer effect on lung cancer cell lines and cervical cancer cell line. The reference I have given. Likewise, the soap which we very often use in our day-to-day life, so that is also has a anti-cancer activity on different human breast cancer cell line, hepatocellular carcinoma cell line, colon carcinoma cell line. Likewise, each drug which I have highlighted here has the anti-cancer activity. And the Unani physicians have linked this soda, the black bile, and the diseased black bile, the morbid black bile, or the production of cancer, which I have already told. So indirectly, these drugs which have been used in the cancer have shown to have anti-cancer activity, which says that these studies in the field of cancer therapy indirectly support and validate the Unani theory of humors, that is particularly black bile, as the single drugs which are mainly used as Munzijate soda and Musile soda are scientifically reported to have anti-cancer activity. So that the claims of Unani physician stands vindicated in the light of these studies which have been carried out on these Unani medicinal plants. So that is how I have. That's why I have written that all the drugs discussed above are having the property of Munzij and Musil, this concoctive and evacuation of black bile. These drugs are highly recommended for the management of cancer. Most of these drugs have been reported for potent anti-cancer and cytotoxic effects by various in vivo and in vitro studies. This is one study which has been a compound Unani formulation, which has been described in the classical text, which is a combination of about 7 drugs, which I have highlighted in the slide. This particular drug has the anti-cancer and free radical scavenging potential of the formulation used in Unani system of medicine. This again is an in vitro study which has been carried out by our institute in Hyderabad. So here again they have tried to prove that these drugs have anti-cancer property and could be used for further studies, so that this could be made into a compound for the could be made that is the data could be generated, and even more robust studies in the form of preclinical and clinical studies are carried out, and then this is brought to the market. Likewise, there is also a drug called the all curcum. This particular drug compound formulation is a polyherbal one. In vitro study has been carried out by the council in collaboration with Amity University, Noida. They have it's a very popular drug used in the treatment of liver diseases. They have tried to see the effect of these drugs on the hepatocellular carcinoma cell lines. Besides the cytotoxic effect on malignant cells, the compound also has protective effect on gene suppressing tumor cells through its anti-inflammatory, antioxidant, and hepatoprotective effect. So not only this particular formulation, but all the other drugs which I have highlighted has this property of they would be also, along with the cytotoxic effect, they will also be exerting their anti-inflammatory, antioxidant, um, then um, then the various organoprotective effect of the drug, different drugs. So that is how these drugs are playing a big role in the management of cancer. Then you have the Ilaj with Tadbir, which is equivalent of Panchakarma in Ayurveda. In Unani, we have different regimens which are adopted according to the diseased condition of a patient. These various regimenal therapies either could be used as prophylactic as well as therapeutic purpose also. So venesection is advised for some types of cancer. Then you have purgation, wherein the decoction of Cuscuta reflexa timon is with moljubin, churned cow's milk for few days, or mol asal. Mol asal means honey water. So decoction of timon with sikanjabin. Sikanjabin is nothing but acetic, there is vinegar and leaven. So these together, those who are strong in build and temperament can use Aerige fekhra. Aerige fekhra is one of the compound drug in Unani medicine, which is used for the evacuation of morbid humors. So these are all some of the purgative drugs which have been recommended in some types of cancer. Then you have the role of dosing, steam bath. Then cauterization is also advised in certain obstinate ulcers. Then application of lintment, particularly of Pinus longifolia or Hildi. Then lead carbonate, Boswellia serrata, Kundar, aloe vera, and Armenian bowl, that is Gele Armani, Pitrosoil. All these drugs have been recommended as an external application. This you can found in the textbooks of Kitabul Mansuri, which has been written by Al-Razi in the 9th century AD. The role of surgery is also there in Unani. So benign answers away from vital organs may be excised surgically. The Unani physicians have recommended, but that has to be taken only after the tanqiya of morbid akhlat from the body. Tanqiya means evacuation of morbid humors from the body. Then deep-seated cancer inside the tissue cannot be surgically removed. We know that once the cancer um, spreads far and wide in the form of metastasis, then it is not recommended for surgical removal. So those type of cancers, it is advised to go for palliative care. So what exactly the mechanism of cancer therapy is, how the drugs should act upon or function is, the aim should be to inhibit cancer cell proliferation directly by stimulating macrophage phagocytosis, enhancing natural killer cell activity. So this is one of the mechanism by which the drugs are functions on the cancer cells. Promoting apoptosis of cancer cells, that is the death of cancer cells, by increasing production of interferon 1, interleukin 2, immunoglobulin, and complement in blood serum. If a drug has this property, then it could be used as a cancer therapy. Then enforcing the necrosis of tumor and inhibiting its translocation and spread by blocking the blood source of tumor tissue is again the mechanism by which a drug may play the role of in the cancer therapy. Enhancing the number of leukocytes, WBCs, and platelets by stimulating the hemopoietic function. That could also be one of the mechanism for the drugs which are used in the cancer therapy. Promoting the reverse transformation from tumor cells into normal cells. This could also be one way. Promoting metabolism and preventing carcinogenesis of normal cells. Here the role of this good diet, good lifestyle, moderate physical activity, moderate mental activity, moderate sleep, and moderate wakefulness. All these play a very important role in the promoting the metabolism and preventing carcinogenesis in the normal cells. Stimulating appetite, improving quality of sleep, relieving pain. Thus, these all benefits the patients. We see in the cancer patients, the cancer patient lacks appetite. There is a disturbance in sleep. Pain is there. If drugs remove these type of symptoms, then that could also play a role as an adjuvant along with the standard therapy also in future. So these are all the strategies for research, not only in medicine but any system to say. In vitro cell line studies, we know that the first step to know to to know whether the drug has an anti-cancer activity or not is to go for in vitro study, cell line studies. So HELA, this is one of the commonest human cell line and the oldest one, a standard one, which is used by most of the scientists throughout the world. So these are all the different cell lines on which studies could be carried out. The use of cancer cell lines allows an increment of information about the deregulated genes and signaling pathways in this disease. Some of the common cell lines on which studies are carried out, as I said, the human cell lines HELA is the most oldest one, the standard one, which is widely used by the most of the scientists. These are all the different cell lines on which studies could be carried out. Then we have then the next step is the in vivo studies. For the anti-cancer preclinical studies, Swiss albino mice are commonly used as an in vivo model. Various concentration of extract of Unani drugs may be studied on the above cell lines. These are all the future strategies I am telling. Then it can also be used as adjuvant therapy. The surgeries and the complex treatment regimens used in cancer management mainly to describe adjuvant cancer care. Traditional medicines can play a very vital role in ameliorating the sufferings of the cancer patient. But unless in vitro and in vivo studies reveal promising results, it cannot be administered without undergoing above studies. So the role of in vitro and in vivo studies, nobody can deny its importance. So we have to go step by step to prove to bring it to a stage where it could be given as an adjuvant therapy, for which sufficient data has to be generated. To conclude, I would like to say that the concept of cancer, that is sartan, and its management through different regimens has been cited in Unani classical texts by different physicians. Linkage of cancer to erratic lifestyle and hereditary factors had been quoted by Unani scholars way back in 9th century itself. Many single drugs used in Unani system for the disease have been evaluated for anti-cancer activity and found to be very effective, as it possesses good immune modulatory and antioxidant besides cytotoxic properties. But little attention has been paid to elucidate the efficacy of compound formulations. Very few formulations have been taken up, for which again different in vitro, in vivo, and adjuvant studies are to be taken on war footing basis to scientifically validate and testify the claims. With this, I conclude, and once again I thank the esteemed director of Moraji Desai National Institute of Yoga for giving me this wonderful opportunity. For giving me this wonderful opportunity to present. With this, I conclude. Thank you. Jai Hind.
Thank you, Doctor. It's very informative, and many people not aware of the strength of Unani medicine, and in a very simple terms, and you narrated the whole about cancer and also the holistic approach of its management through Unani medicine. Thank you very much. Now I request to Dr. Vandana to take up the questions if are in the chat box.
Thank you so much, sir. Sir, somebody has asked if if somebody has a cancer problem, cancer disease in his genetic line, then how can he or she make changes in his lifestyle so that she can avoid cancer further?
Yeah, I have highlighted during my lecture that there are intrinsic and extrinsic factors. Intrinsic factors are unmodifiable, but the extrinsic factors are modifiable. So the risk of cancer is minimized to a large extent if one attempts to modify his lifestyle. To a great extent, even if one strengthens his immune system, to a great extent, those measures which we take in modifying our lifestyle will definitely suppress the tumor cells in the body. So the genetic factors which are playing a big role in the production of cancer could be minimized to a great extent if we give emphasis on following the modifiable factors.
Thank you so much, sir, for accepting our invitation and enlightening our viewers about cancer and management of Unani system. Thank you so much for joining us today. I would also like to thank Director of Morarji Desai National Institute of Yoga, Dr. Ishwar V. Basavaraddi sir, for taking out time from his busy schedule and joining us today. आपका भी बहुत बहुत धन्यवाद sir.
Thank you, Vandana.
I would also like to thank Communication and Documentation Officer of MDNIY, Mohammad Tayyab Alam sir, for his help and support. Thank you, sir. Thank you to our technical team and all our viewers who have joined us today. आप सभी का बहुत बहुत धन्यवाद. और अब कार्यक्रम का समापन शांति पाठ के साथ. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् मा कश्चित् दुःखभाग् भवेत्. ॐ शान्तिः शान्तिः शान्तिः. Thank you so much, sir. Thank you once again.
Thank you very much. Sir, I hope that opportunity will be given for me to in the near future about the healthcare concept of healthcare in Unani medicine.
Definitely, sir. We'll be in touch with, and I'm very pleased to meet you. And it was really, I enjoyed.
Thank you very much, sir.
Lecture, and it was good. Thank you very much.
Thank you. Welcome, sir.
Thank you, sir.
Thank you very much. Welcome, sir.